Hello, my name is Emilee and I did my research paper over cognitive behavioral therapy. The cognitive behavioral therapy process plays a big role in resolving negative behavior and unrealistic thoughts that characterize some members of the society. Through this method, some patients have been able to engage in positive thinking and such as engaged in living healthier lifestyles. However, there are various questions about this process that needs to be addressed in order to fully understand this type of behavioral therapy. It is prudent to find out who came about with this kind of therapy, how it works, and the components that make up this therapy. The cognitive behavioral therapy, CBT, helps individuals in realizing when they make negative interpretations and weird behavioral patterns which result in disordered thinking. CBT plays a big role in the development of alternative ways that people can use in thinking and behaving to help them reduce their psychological stress. The main aim of the cognitive behavioral therapy is not to diagnose people with specific diseases, but rather looking at the person's behavior when deciding on what needs to be fixed according to OCT 2011. It is important to note that the therapy was originally designed to treat depression, but is used as a remedy for many mental illnesses today. The cognitive behavioral therapy was founded by Albert Ellis and Aaron B. T. Beck. This behavioral therapy assumes that abnormality results from vague and faulty conditions about other people, the world at large, and even us. This kind of thinking may be exhibited through negative deficiencies or cognitive disorientations. Secondly, the cognitive causes errors in the manner that people see things. The founder of this therapy refers to this as the cognitive triad. The third assumption states that people interact with the world through their mental representation about the world according to OCT 2011. It further states that if one's ways of reasoning are deemed to be inaccurate, then their behaviors and emotions become disordered. The CBT process is highly goal-oriented therapy method which entails the involvement of both parties in question, where the therapist and the patient working together towards the achievement of specific goals and objectives according to Cole and Morris 2011. The therapist normally explains the entire process to the patient, who is given some assignment to do in between the therapy sessions. The CBT treatment method is an effective short-term remedy that is normally designed to help patients in dealing with a specific issue. There are some types of cognitive behavioral therapy, which are brief cognitive behavioral therapy, structured cognitive behavioral training, moral inoculation, rational emotion behavioral therapy, and medical uses of cognitive behavioral therapy. The brief cognitive behavioral therapy is a kind of therapy that was developed for conditions that are characterized by time constraints on the therapy sessions. The structured cognitive behavioral training is a type of cognitive therapy that is characterized by some core philosophies that are similar to those for the cognitive behavioral therapy. The moral inoculation training uses a mixture of behavioral, humanistics, and cognitive training methods to determine what can be stressing a particular patient. According to Beck in Washshire, 1989, this type of therapy, the rational motive behavioral therapy, focuses on identifying and changing various irrational beliefs about a particular subject. Medical uses of cognitive behavioral therapy is usually used in treating a variety of behavioral disorders such as addiction, depression, phobia, and anxiety. Another way that this therapy can be put into the application is the fact that it helps in changing negative thoughts that can be contributed to emotional difficulties such as anxiety and depression. According to Foyted, it is important to note that the method has played such a big role in shaping the manner that some people tend to think. Various scholars further argue that it is a very effective method of treatment for people who tend to suffer from emotional distress. In my opinion, further research is needed to establish a manner that will help address the limitations that characterize this type of behavioral therapy. Thank you.